1 in 4 women, but many are too embarrassed to talk about it. However, urinary incontinence does not have to go untreated. This is Dr. Aimee Nguyen of North Dallas Urogynecology. She's here to talk about treatment options, and it includes a new product that treats incontinence in a new way. Dr. Aimee, how are you today?
Good. Thank you so much.
You're welcome. How prevalent is this topic in women?
It's a very common condition. So urinary incontinence affects approximately 1 out of 4 American women, which is about 40 million women. And the risk factors for developing urinary incontinence include those women who've had children, having been postmenopausal, obesity. The good news is that this condition can be successfully treated, and women don't have to be embarrassed about talking about it.
Okay, so obviously 1 in 4 seems like a really staggering statistic. So I'm guessing there are a lot of women who just aren't talking to their doctors about this because of the shame or embarrassment about it. It's a hard topic to bring up, would you say, doctor?
Absolutely. Unfortunately, it's still really taboo. It's a condition where women are very embarrassed to talk about it. A lot of women assume that it's a normal part of aging or childbirth. My hope is that more women will feel comfortable talking to their physicians about it and not be so ashamed about it.
Are there different types of incontinence? You mentioned there could be different reasons that we could develop this, but what are the different types?
Absolutely. The 2 most common types of urinary incontinence are stress urinary incontinence. That's that leakage that happens with exercise, lifting, coughing, sneezing, where you feel like you have to cross your legs. The other type of leakage is what we call urge urinary incontinence, where you get that urge to urinate and you might not make it to the bathroom in time.
Okay, so there's different types. Sometimes maybe people think it's just a part of life or getting older, and so that might be another reason they don't talk about it or seek treatment for it. Okay, so let's talk about the treatment methods that are available.
Well, the current treatment options that we have often have mixed results. So absorbent, pads, diapers, we know do nothing to treat the condition. Medications, although can be successful, oftentimes are associated with side effects. Surgery can be invasive and have complications. Kegel exercises, while they work, oftentimes are done incorrectly. And so what's nice about this new InTone device, and I'm going to show you, is that this is a home unit that actually women can use in the privacy and comfort of their own home when it's convenient for them. And so what happens is that this slim part of the device actually is inserted inside a woman's vagina for about 10 minutes, and it's hooked up to this little computer. And it's almost like having your own personal trainer. So basically, it guides you, it's voice commanded, and guides you through a 10-minute session of Kegel exercises, gentle muscle stimulation to actually strengthen the muscle floor. What's amazing about it is that within a couple of weeks, women will start to notice a difference. I just saw a patient on Monday who actually suffers from really severe leakage, where she soaks through a pad about 3 times.
Wow, that's significant.
3 pads a night, and she's seen many physicians, has had surgery, has had multiple medications.
And what has this been for her?
With no difference, and within 2 weeks, she's completely dry. And so, as a urogynecologist, for me to be able to give a woman her freedom back and not have her fear leakage is what makes my job fun, makes it enjoyable.
So what would be the takeaway for GMT viewers today? What do you hope that they do? Start the conversation and ask if there's treatment options for them?
Absolutely, absolutely. At least start that dialogue with your physician. If you're socially bothered by it, know that there are successful treatment options and we can get you dry.
Okay, thank you so much, Dr. Aimee, for being here today. We appreciate it.
Thank you.
Now, for more information, call this number. The North Dallas Urogynecology office is 469-234-8888, or you can log on to their website. It's incontrolmedical.com.